Hello everyone, and welcome back to our channel. If you're preparing for the NCLEX, you're in the right place. Today we're diving into a crucial topic that every nursing student needs to master: pharmacological and parenteral therapies. Whether you're just starting your review or you're in the final stretch before test day, understanding these concepts is key to not only passing the NCLEX but also to excelling in your future nursing career. Are you ready to boost your knowledge and ace your exam? Let's get started with our first practice question. And if you find this video helpful, don't forget to like, subscribe, and click the bell icon so you never miss out on our helpful NCLEX prep content. Here we go. A patient has been prescribed a new medication that has a black box warning regarding potential liver damage. What crucial education should the nurse provide to the patient? Is it A, double the dose if symptoms do not improve within a few days? B, discontinue the medication if they experience any gastrointestinal upset? C, report any signs of liver dysfunction such as jaundice, dark urine, or unusual fatigue? Or D, only take the medication with grapefruit juice to enhance absorption? The correct answer is C, report any signs of liver dysfunction such as jaundice, dark urine, or unusual fatigue. Black box warnings signify that there are serious or life-threatening risks associated with the medication. In the case of potential liver damage, it's crucial to educate the patient on the signs of liver dysfunction and to report them immediately to their healthcare provider. The other options provided are incorrect and could lead to harm. Okay, next question. A nurse is caring for a client who is receiving intravenous furosemide, Lasix, for heart failure. Which of the following lab results should the nurse report immediately to the provider? Is it A, potassium 4.0 milliequivalents per liter, B, potassium 3.0 milliequivalents per liter, C, sodium 142 milliequivalents per liter, or D, calcium 9.3 milligrams per deciliter? The correct answer is B, potassium 3.0 milliequivalents per liter. Furosemide is a loop diuretic that can cause significant loss of potassium, leading to hypokalemia. A potassium level of 3.0 milliequivalents per liter is below the normal range, which is 3.5 to 5.0 milliequivalents per liter, and can cause cardiac dysrhythmias, which are potentially life-threatening. Therefore, this lab result should be reported immediately. The sodium and calcium values provided are within normal limits and not as concerning in this context. Next up, a client with rheumatoid arthritis is prescribed methotrexate. Which of the following laboratory results should the nurse monitor closely? Is it A, platelet counts, B, blood glucose levels, C, liver function tests, or D, serum sodium levels? The correct answer is C, liver function tests. Methotrexate is a disease-modifying anti-rheumatic drug that can have hepatotoxic effects. Therefore, liver function tests such as ALT, AST, and bilirubin should be monitored closely to detect potential hepatotoxicity. Regular monitoring is crucial to prevent serious liver damage. Serum sodium levels and blood glucose levels are not directly affected by methotrexate. Although methotrexate can impact bone marrow function and cause thrombocytopenia, liver function tests are a priority due to the high risk of liver toxicity with methotrexate. Let's try this question. Which of the following should be monitored closely when a client is receiving an infusion of intravenous dopamine for the treatment of shock? Is it A, serum glucose levels, B, urine-specific gravity, C, peripheral edema, or D, cardiac rhythm? The correct answer is D, cardiac rhythm. Dopamine is a catecholamine that increases cardiac output and improves hemodynamics in shock. It can cause tachycardia, arrhythmias, and other cardiac effects. Thus, cardiac rhythm must be closely monitored. Peripheral edema is more indicative of fluid status or heart failure. Serum glucose levels are not generally affected by dopamine, and urine-specific gravity reflects hydration status, but is not directly related to the administration of dopamine. Let's keep going. A patient is receiving gentamicin for a severe bacterial infection. Which of the following should the nurse monitor as a priority to detect nephrotoxicity? Is it A, serum creatinine and blood urea nitrogen levels, B, complete blood count, C, coagulation profile, or D, liver function tests? The correct answer is A, serum creatinine and blood urea nitrogen levels. Gentamicin can cause nephrotoxicity. so monitoring serum creatinine and blood urea nitrogen levels is essential to detect any kidney impairment. Liver function tests, complete blood count, and coagulation profile are not specific indicators of nephrotoxicity. Next question. Which medication requires the nurse to monitor the client's serum potassium levels when administered? Is it A. Levothyroxine, Synthroid, B. Metoprolol, low pressor, C. Furosemide, Lasix, or D. Spironolactone, aldactone? The correct answer is D. Spironolactone, aldactone. Spironolactone is a potassium-sparing diuretic, which can lead to hyperkalemia. Monitoring serum potassium levels is essential to prevent complications. Furosemide is a loop diuretic that can cause hypokalemia, while the others do not typically affect potassium levels. Let's try this one. Which of the following is a common side effect of ACE inhibitors such as lisinopril? Is it A. Hypokalemia, B. A persistent dry cough, C. Constipation, or D. Tachycardia? The correct answer is B. A persistent dry cough. A common side effect of ACE inhibitors is a persistent dry cough, which can lead to medication non-compliance. Hypokalemia is more commonly associated with diuretics, tachycardia with vasodilators, and constipation is not typically associated with ACE inhibitors. What is the most appropriate action for a nurse to take when a client reports chest pain after receiving nitroglycerin sublingually? Is it A. Immediately administer a second dose of nitroglycerin, B. Reassure the client that chest pain is a normal side effect, C. Assess the pain and notify the healthcare provider if pain persists, or D. Instruct the client to drink water to alleviate the chest pain? The correct answer is C. Assess the pain and notify the healthcare provider if pain persists. If a client reports chest pain after receiving nitroglycerin, the nurse should assess the pain and notify the healthcare provider if the pain persists, as it may indicate ongoing myocardial ischemia. Additional doses may be given at intervals if prescribed, but not immediately. Chest pain is not a normal side effect and should not be dismissed, and drinking water will not alleviate ischemic chest pain. Let's answer a couple more questions. Which medication requires the nurse to monitor the client's hearing as a part of the therapy? Is it A. Ibuprofen, B. Ciprofloxacin, C. Amikacin, or D. Metronidazole? The correct answer is C. Amikacin. Amikacin, an aminoglycoside antibiotic, can cause ototoxicity, which may manifest as hearing loss or tinnitus. It is important to monitor the client's hearing to detect any early signs of ototoxicity. The other medications listed do not commonly cause ototoxicity. Okay, last question. A nurse is caring for a client who is receiving a blood transfusion. What is the priority nursing intervention during this procedure? Is it A. Monitor the client closely for the first 15 minutes for any signs of a transfusion reaction, B. Increase the infusion rate if the client reports feeling cold, C. Add a dextrose solution to the blood product to prevent hemolysis, or D. Administer the blood transfusion through a standard IV line with a 20-gauge needle? The correct answer is A. Monitor the client closely for the first 15 minutes for any signs of a transfusion reaction. The priority nursing intervention during a blood transfusion is to monitor the client closely for the first 15 minutes for signs of a transfusion reaction, which is when most reactions occur. Increasing the infusion rate can worsen a reaction, and blood should be administered through a blood transfusion set with a filter, not a standard IV line. Dextrose solutions should not be added to blood products as they can cause hemolysis. All right, that wraps up our session on pharmacological and parenteral therapies NCLEX practice questions. I hope these explanations helped clarify some tricky concepts and boosted your confidence. Remember, practice makes perfect, so keep reviewing and testing yourself. If you found this video useful, give it a thumbs up and subscribe to our channel for more NCLEX prep content. Drop your questions and feedback in the comments below. Thanks for watching, and see you in the next video.